right? My son found, a week or two ago, the old swine flu folder, right? And it doesn't contain everything that I've seen, right? I made a swine flu folder. I also have massive amounts of paperwork in my house that I never got around to filing in these years that I did this shit. But let's just go by the ones that I have actually found, right? So we've got the 25th of April 2009, right? Flu pandemic fears grow with more US cases. Let's see what it says. The thing, it says like, a new flu that has killed up to 68 people in Mexico could start a global epidemic, the World Health Organization warned on Saturday, as tests showed the strain might be spreading into the US. Do you see the similarities there? They get more, right? Tests confirmed that 8 New York City school children had a type A influenza virus that was likely to be the swine flu. Blah, 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 right? Down the bottom, it says Mexico has said the flu had killed 20 people and could be to blame for 48 more deaths. So the beginning line, a new flu that has killed up to 68 people, had only killed 20 people. And they fudged the figures. Do you see again the correlation, the link? Right, and then we've got pandemic. Again, this is, so that was Saturday the 25th of April 2009. Friday the 1st of May 2009. Pandemic could kill 750,000 people in the UK. Up to 1.2 million people could end up in hospital and 750,000 killed if a flu pandemic, they don't put if, because of course they won't, if a flu pandemic sweeps the nation, according to draft government guidance about an outbreak. Again, similar thing. We've got a model. We made a model. Of course we're right. Well, of course you're not. As hospitals are rapidly, that one is in quotes, rapidly, hospitals are rapidly overwhelmed by patients, doctors may have to begin operating a lottery system, again, similar, for intensive care, the blueprint from last year adds. It also warns that a worst-case pandemic scenario of catastrophic severity could result in the complete or partial collapse of some or all hospital infrastructures. End quote. Top medics have downplayed the predictions, saying factors like Britain's high state of readiness and high immunity levels will lessen the impact. You know, you see the common theme here. People are downplaying it. No, it's way worse than it is. Where's the proof that it's way worse than it is? Show me that proof and I will believe it's way worse than it is. Well, I probably won't, but because they fudge the figures and they fudge the figures with swine flu. It says up to half the UK population, or 30 million people, could get influenza if the bug outbreak turns into a pandemic. In the worst case, there would be 2,000 hospital admissions per 100,000 people, or 1.2 million people. There would also be 1,250 fatalities, nearly that went into fatalities, per 100,000, or 750,000 people. The report says, over the entire period of a pandemic, up to 50% of the population may show clinical symptoms of influenza. This could result in the total healthcare contacts for influenza-like illnesses increasing from around 1 million during the normal season up to 30 million. Like, bearing in mind this is 11 years ago, right? So they were plugging this shit then. There are also grim implications for the demand of the nation's estimated 3,450 adult intensive care beds and 320 children. Well, obviously this year they've built shitloads of new hospitals that have got nobody in them. So that was in May of 2009. Now we've got Sunday the 25th of October 2009. US President Barack Obama has declared the swine flu outbreak a national emergency and empowered his health secretary to suspend federal requirements and speed treatments for thousands of infected people. The declaration authorises Health and Human Services Secretary Kathleen Sebelius to bypass federal rules. Again, anything new? So health officials can respond more quickly to the outbreak. So, like, this is in October. This first started in April. And in October, they're saying that this is still a thing. And it wasn't. Which has killed more than 1,000 people in the United States. 1,000 people from April to October. 1,000 people it killed from April to October. How do they know? All of that fandango. I'm sorry, but I'm just not buying it. I'm just not buying it. The goal is to remove bureaucratic roadblocks and make it easier for sick people to seek treatment and medical providers to provide it immediately. So you're calling on Big Pharma to help out the little man, which is exactly what happens with cancer and other things. It's like, yeah, let's just put all our money, because at the end of the day, if we put our faith in Big Pharma, we're putting taxpayers' money into Big Pharma too. As a nation, we have prepared at all levels of government and as individuals and communities, taking, this one got me, unprecedented steps. Again, like, anybody seeing a theme here? Unprecedented, mate. Steps to counter the emerging pandemic. Mr. Obama wrote in the declaration, he said, the pandemic keeps evolving. The rates of illness are rising rapidly in many areas, and there's a potential to overburden healthcare resources. Same old, same old. Like, literally, it's a script, mate. I'm reading from a script. Because of vaccine production delays, you couldn't fucking make this shit. Well, they have. Like, because of vaccine production delays, the government has backed off initial optimistic estimates that as many as 120 million doses would be available by mid-October. As of Wednesday, only 11 million doses have been shipped to health departments, doctors' offices and other providers, according to the Federal Centers for Disease Control and Prevention. The government now hopes to have about 50 million doses of swine flu vaccine out by mid-November and 150 million in December. The flu virus has to be grown in chicken eggs, and the yield hasn't been as high as was initially hoped, officials explained. Swine flu is more widespread, because they're words, widespread now than it's ever been. Health authorities say almost 100 children have died from the flu, known as H1N1. Oh, bastard. What the fuck is going on? Like, no! Why did it do that? Like, literally, I do apologise. I'm just going to leave it playing. Fuck it, I don't mind looking like a spag. Swine flu is more widespread now than it's ever been. Health authorities say almost 100 children have died from the flu. And 46 states now have widespread flu activity. Right. Then we go on to, and this one I absolutely love this. Right. This is from the 18th of November 2009. Patients shunning flying swoo. More than half of patients are turning down the swine flu vaccine, a snapshot survey has suggested. A Pulse magazine poll of 107 GPs found that some people were concerned about possible side effects of the jab, while others believed there was no need to have it because the virus is mild. Family doctors are currently vaccinating people at high risk from swine flu, including pregnant women, like I ain't tagging my daughter in this, health workers, and those with asthma, heart disease and diabetes. The poll of GPs in England found resistance to the jab was particularly high among pregnant women, and overall only 46% of patients offered the vaccine are thought to have said yes. One family doctor estimated that as few as 1 in 20 pregnant women were opting to have the vaccine. Last week, the government published online information and leaflets aimed at persuading pregnant women to have the vaccine. Why? Argument for a whole new day. Oh, fuck it. Right, where were we? The new swine flu infections is currently hovering around 64,000 a week in England. So, like if you're a researchy person, just see what's going on, like with coronavirus, and see if them numbers tally. Public concern over the vaccine safety has become heightened in recent months. There are several reasons people seem to... No. Oh, I'm fucking so confused. Let's just skip. Some pregnant women are also worried that the jab has not been tested on their group. However, no vaccine of any kind is routinely tested on pregnant women. So why are they pushing it on pregnant women? Why should pregnant women have it when there's absolutely zero proof of efficacy with pregnant women? However, the pandemic vaccine has been the subject of more intense debate because it contains an adjuvant. This is a chemical which heightens the immune response and